Okay, so here are the top 5 reasons that I predict psychedelic therapy will be the next big thing in the field of therapy, counseling, psychology, mental health, all of that. This is not a recommendation to take any illicit drugs. This is not medical advice. These arguments, this is more of a prediction. And this prediction led me to really develop the whole Pentabelt program. So this is my prediction for the reasons that psychedelic therapy will likely take over the field of therapy within the next 10, 15 years. Okay, let's go through them. Reason number 1, look, psychedelics appear to be pretty safe and actually quite effective. I spent a bit of time early in my career, especially before getting my licensure, helping people quit smoking. And smoking is one of those really tough things to beat. Many people would argue is harder than drinking, illicit drugs. It's really a tough thing. And when I was helping people quit smoking, I would be happy to have a 40% success rate. So you work with people, 10 people, you follow up with them 6 months, a year down the line. I'd be happy if 4 out of those 10 reported being smoke-free, Just the success rates have always been pretty dismal. Even applying the nicotine replacement therapy, even applying vaping, quitting nicotine is a difficult thing. So they did a study in Johns Hopkins, famous medically oriented school in Maryland, I believe, and they used psilocybin. They used magic mushrooms to help people quit smoking. And normally in their control group, they got around 35-40%. But when they integrated psilocybin, when they integrated magic mushrooms, their success rate shot up to 80% at 6 months. So that means when they survey people, when they had people take like a nicotine test to confirm that they were smoke-free, they had an 80% success rate at 6 months. Now that is amazing. That's double the success rate of the control group. That is extremely impressive. And really, smoking kills about 1/3 of the people who use it, right? 1/3 of the people who smoke will end up dying from it. So if you take 100 people, and instead of having a program that is 40% effective, it's 80% effective, you end up saving about 13 people from that 100. Like that's a significant, amazing result. And of course, this is one study, but it just is a lot of the meta-analyses, a lot of the studies are showing that when used in a proper setting, when used with a trained clinician in the right environment, the psychedelics appear to be quite effective and pretty safe. The great thing about the program is that it can be merged with anything else. So many people who want to quit smoking, they'll read Alan Carr's book, The Easy Way to Quit Smoking. And that can be very effective on its own, but when you mix it with other things, in this case, when you mix it with psychedelics, the success rate appears to dramatically increase. And so it's for this reason that the FDA gave breakthrough status generally for psilocybin for depression and MDMA for trauma, meaning that when other approaches have had mixed results, not that great, these substances appear to have like a breakthrough in terms of efficacy. So that's very, very important. Right? Getting that breakthrough status is sought after by all the pharmaceutical companies. So to get that for MDMA and psilocybin is really quite impressive. The second reason is the dodo bird effect. Consumer Reports, a few years back, they did a big study on therapy. Now they usually assess dishwashers, refrigerators, cars. If you're trying to find a new appliance, Consumer Reports will give an unbiased assessment. They'll compare it, all the different features, and they took a look at therapy. And so they surveyed thousands of people who were in therapy. They took a bunch of how how close, how connected were you with your therapist? How experienced was your therapist? What's the therapist orientation? And then they asked, did you find the therapy effective? How did it help you? And they found that by and large, it doesn't really matter the therapeutic orientation of the therapist. It didn't really matter how many years this therapist was practicing. Right? It didn't even matter in some cases, the level, whether the person's a PhD or a master's or whatever. The big thing that they found, there's really one factor, and that is the therapeutic alliance. That is the connection between the participant or the client and the therapist. In fact, they called this the dodo bird effect because from Alice in Wonderland, everyone's a winner and everyone gets prizes. It doesn't seem, a lot of these other factors about therapy don't seem to move the needle much, except the rapport, the connection, the camaraderie, the sense of positive regard that exists between the therapist and the client. So if someone's really looking for the best therapist, it may not be as important what the therapeutic orientation or even the level of experience, but rather, can you feel a sense of connection with this therapist? Well, it turns out that one of the things that can really enhance the therapeutic connection is with this psychedelic therapy. I've just found for myself that when a client engages in ketamine therapy or psychedelic therapy, and I'm there to kind of hold space for them and we process what comes up, the result is just an enhanced connection, just a greater sense of bond. From my own perspective, during graduate school in the field of therapy, they really want you to work with a lot of different therapists. So I've had experience working with therapists of different orientations and backgrounds, and therapists who've had the same kind of cultural background, and a therapist very, very different. And I feel like I've gained from each one of them. But my first psychedelic therapy session was with actually like a pastor, didn't have that much training, just a pastor who lost his faith, came down to LA. And I have to say that I have a greater bond with this person to this day than with anybody else. I feel like I gained so much more. All this person did was ask me some of the questions that I gave to this person and just held space. And that person was there to witness some real profound insights that I really discovered for the first time about myself. And it's a very bonding experience. And likewise, I just find that when I'm working with clients, after a few sessions with ketamine therapy, there's just a noticeable increase in a sense of connection, camaraderie. The person's more willing to disclose things. The client just feels, I don't know, it's hard to describe. But that sense of camaraderie is a crucial, important component of the therapeutic process. A lot of people, the people who most need therapy are those least likely to go and will often have the most difficult time connecting. A lot of people have relationship problems because of attachment trauma, and that same attachment trauma can make it difficult to really connect with a therapist. Well, with these substances, it just appears to enhance that whole process, which can have profound implications. Okay, so that's the second reason. The third reason, point blank, it is a transformative experience. The best analogy is traveling, right? There's just something about going to a different country, going to a different part of the world, learning about yourself, and then from that distance, kind of learning about how you do things at home. Noticing a different culture kind of helps teach you about your culture, for better or for worse, back home. Likewise, a psychedelic journey can also be transformative. And some of the insights can be, very mundane, but transformative. So if I'm helping someone quit smoking and they have the ketamine therapy session, their big insight, mantra, aha, might just be smoking is dumb. But often with these sessions, there's a sense of connection, a sense of spirituality. It's as if the universe is saying smoking is dumb. And that just seems to hit home. So that when a person is out and about, even if they're stressed, someone offers them a cigarette, the thought that comes in is smoking's dumb, right? People consistently say that a psilocybin experience, the ketamine journey, is among the most spiritual experience that they've ever had. And studies have shown that when you have that spiritual experience, you're just more likely to take the message home and have that kind of therapeutic effect. And it just seems that having that transformative effect kind of cements the healthy changes. There's just something special about going through it and having that transformative experience and then really wanting to apply those lessons in your day-to-day life. Reason 4 is that it is novel, okay? Let's take someone who's tried to quit smoking. Studies show, a person will only give so many shots for quitting smoking. They might try like a course, they might try vaping, they might try nicotine replacement therapy, and if it doesn't work, they just sort of give up. Well, psychedelic therapy is demonstrably a very different approach, right? So I can say to somebody, who's trying to quit smoking, have you tried different types of therapy? Sure. Have you tried, this medication? If you ask them if they've tried psychedelic therapy, they either have or they haven't. It's definitely something that you're not going to forget about. You've either tried it or you haven't. And so somebody who has tried everything, who then gets told about ketamine therapy or psilocybin therapy, they're just more likely to say, sure, let's give it a shot, right? It's easier to sort of see that as a novel approach. And this is important. A lot of people, they try therapy a few times and it doesn't work and they shrug their shoulders. Well, this could be a novel approach. Many people are curious about the whole process. Many people will come in just to get the experience, and then if they have to think about something to work through, they might just determine that it's cigarettes, and that can be a therapeutic approach. And the 5th reason, and this is the most controversial, it does feel good, right? I'm actually tempted to exclude this reason, but we have a kind of theme of 5 here. So the ketamine process, the psilocybin, especially MDMA, it often generally feels good. And the profound thing about that is that it can then encourage people who might not have considered therapy to start, and it would encourage people who are doing it to continue. So with my ketamine program, the first 2 rounds is basically 8. Well, rarely people will just stop at 6. Even if they see significant progress at the 6th ketamine session, the fact that you're getting insights, you're learning about yourself, and it's oftentimes a positive experience, and sometimes it does feel good, they're more likely to continue. They're more likely to take those remaining 2 sessions where in those 2 sessions we can focus on things, reinforcing things, relapse prevention, resolving any of the other stressors that could cause the main issues to come back. Just a lot of good work can come because it's at times enjoyable experience. Think of it like a couple who would think of doing let's say a marriage workshop. So let's say that my spouse comes to me and says, hey, let's do a marriage workshop. Maybe once a year they have this weekend-long marriage workshop where you go in and you do different processes. Well, it's a weekend. It's, if I feel like the marriage is going pretty well, is there a huge need? Maybe we could do something else and we can just get dinner. But if it's, let's say it's in the future and once a year you can work with a therapist in a center, and they just allow a a weekend workshop that involves, ketamine therapy or something else, whether that's, psilocybin or MDMA. Well, generally speaking, these are good positive experiences. And so I'm just more likely to say, okay, let's see what happens. If nothing else, it's a great experience to bond. And then as part of that weekend, any issues that come up, and issues of course do come up in any marriage, can be resolved. I never really quite understood the focus of marriage and family therapy as when a marriage is on the cusp of divorce. So you have these two couples, and through the years, issues come up. And then when it's either therapy or splitting, then they start the therapy. The reality is that perhaps, once a year, engaging in psychedelic therapy as a couple can help prevent many of these issues before they end up on the pathway to splitting up. In other words, there is likely going to be a big shift towards prevention, right? Let's focus on issues before they balloon into addictions, before the progression towards major depression or generalized anxiety. And the idea is that these processes with psychedelic therapy, sometimes they can be challenging. Sometimes some of the things are a bit difficult, emotions come up. But by and large, it's also, a very wonderful thing. It's a great sensation. And the fact that there are often really good moments can encourage people to start the process, continue it, and come back from time to time. And what we're really finding, just like in the field of medicine, prevention is way, 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 way preferred towards treatment. If a couple can take once a year to resolve any hiccups, any issues, that can go a very long way. I work with people who are having problems in their relationships. Oftentimes they'll say this really important thing, this really heartfelt message towards me. And part of me just wants to say, I type out what they're saying, just email them to the client and say, share this with your spouse, right? Share this with your significant other. How come you're telling me? Well, if you can take one weekend out of the year where your guard is lowered a bit, where the ego is not as present, and communicate these issues, it could go a long way towards preventing future problems. And so it's for all of these reasons that I believe that psychedelic therapy is going to be the future of therapy. Again, I'm not recommending that everybody go out and immediately start this stuff. I'm simply making a prediction about where I see the field of therapy going within the next 5, 10, 15 years. So for the next clip, let's explore the greater implications of this. Is what I describe as the fifth wave of therapy. Thank you.